Look on the trigeminal nerve, which is the fifth cranial nerve. There are 12 pair of cranial nerves. Out of the 12 pairs, there is the fifth cranial nerve. Okay, trigeminal nerve, which is the fifth cranial nerve. And here is the diagram of nucleus, which is located in the brainstem. Okay, so for the trigeminal nerve, there consists of one motor nucleus and three sensory nucleus. One motor nucleus and three sensory nucleus. So the sensory nucleus are mesencephalic nucleus, main sensory nucleus, and spinal nucleus of trigeminal nerve. The three sensory nucleus are mesencephalic nucleus, main sensory nucleus, and spinal nucleus of trigeminal nerve. And then there is one motor nucleus. Here in this picture, you can see here this is the middle cranial fossa. This will become the orbit, and this is the maxilla. Okay, and here is the brainstem. So from the brainstem, these four nucleus arises, the three sensory and one motor nucleus arises, and the sensory nerves, it arises from the brainstem in the posterior cranial fossa, enters into the middle cranial fossa, and here it reaches to the trigeminal ganglion. And from the trigeminal ganglion, these sensory nerves, which divides into three. First one is the ophthalmic nerve, second is the maxillary nerve, and third is the mandibular nerve. Okay, first ophthalmic, second maxillary, and third is the mandibular nerve. Today we are going to look on the course of mandibular nerve. So the mandibular nerve, which consists of two roots, the sensory and the motor root. Sensory root and the motor root. The sensory root leaves the middle cranial fossa through the foramen ovale, and the motor root, which runs just below, it passes below the trigeminal ganglion and to the sensory root, and it also passes out the middle cranial fossa or the cranial cavity through the foramen ovale. So the sensory and motor root, which passes out to the cranial cavity through the foramen ovale. After coming through the foramen ovale, these two branches unite each other. After coming out through the foramen ovale, these two roots, sensory and motor root, join to form a main trunk, and the main trunk lie in the infratemporal fossa on the tensor veli palatini and deep to the lateral pterygoid muscle. After a short course, it divides into anterior division and a posterior division. Okay, it divides into anterior division and a posterior division. Here is the division and branches of the mandibular root. So here is the motor root and here comes the sensory root. Okay, so we told that it has a main trunk. It has a main trunk. Then after coming out through the foramen ovale, it join to form a main trunk. After that, it divides into anterior division and a posterior division. So from the main trunk, it has two branches, meningeal branch or nervus spinosus and nerve to medial pterygoid. From the main branch or main trunk, it give off two branches, meningeal branch and the nerve to medial pterygoid. From the meningeal branch, it give meningeal branch and nerve to medial pterygoid, and from the anterior division it give off deep temporal branch to lateral pterygoid, masseteric nerve, and one more branch is the buccal nerve. The buccal, out of the anterior division, there it give four branches, and in these four branches the buccal nerve is only the sensory branch, and here from the posterior division it give off three branches, auriculotemporal nerve, lingual nerve, and the inferior alveolar nerve. Auriculotemporal nerve, lingual nerve, and inferior alveolar nerve. So from the main trunk there is two division, meningeal branch and nerve to medial pterygoid, and from the anterior division one sensory branch which is the buccal nerve and three motor, this is the deep temporal branch to lateral pterygoid and mesenteric. And from the posterior division, there consists of auriculotemporal nerve, lingual nerve, and the inferior alveolar nerve. First of all, the meningeal branch. Here, the meningeal branch, which is also called nervus spinosus, and enters the skull through foramen spinosum. Along with the middle meningeal artery, the meningeal branch enters into the skull, back to the skull through foramen spinosum, and it supplies the dura mater in the middle cranial fossa. It supplies the dura mater in. Next, the nerve to medial pterygoid. The medial pterygoid, it arises close. This is the aortic ganglion. It arises close to the aortic ganglion and supply to the medial part, medial pterygoid. It supplies to the medial pterygoid muscle. It supplies to the medial pterygoid muscle and also to the tensor tympani and the tensor veli palatini muscle. So the nerve to medial pterygoid, which arises close to the aortic ganglion and supply to the medial pterygoid muscle and also to the tensor tympani and tensor palatini muscle. And here is the nerve of anterior division. There are four nerves of anterior division. First one, the sensory nerve, the buccal nerve. The buccal nerve is the only sensory branch of the anterior division of mandibular nerve, and it passes between two heads of the lateral pterygoid muscle, runs downward and forward, and supply to the skin and mucous membrane related to the buccinator muscle. Okay, and it also supply to the labial aspect of the gum of molar and premolar. Labial aspect of gum only to the region of gum at the molar and premolar teeth. The mesenteric nerve, which emerges at the upper border of, here is the lateral pterygoid, and it emerges the upper border of the lateral pterygoid just in front of the temporomandibular joint, and it passes through the mandibular notch, which is seen on the temporal bone. The mandibular notch, which is seen on the temporal bone, and it passes through the mandibular notch and accompany the mesenteric vessel, and it enters deep surface of the masseter and supply to the masseter muscle and also to the temporomandibular joint. Deep temporal nerve. There are two deep temporal nerve, the anterior and posterior deep temporal nerve. The anterior and posterior, which enters deep surface of the temporalis muscle and supply to the temporalis muscle. The last branch of the branch of anterior division is the branch to lateral pterygoid, and this nerve which supplies to the lateral pterygoid. So the anterior division consists of one sensory branch, the buccal branch, which supplies to the mucous membrane, skin and mucous membrane related to the buccinator, and also to the gums related to the molar and premolar teeth, and the masseter, which supply to the mesenteric muscle, and deep temporal, which supply to the temporalis muscle, and branch to lateral pterygoid, which supply to the lateral pterygoid muscle. Then we are going to look on the divisions of posterior division, branches of posterior division. First one is the auriculotemporal nerve, and this is the auriculotemporal nerve. The auriculotemporal nerve, which arises by two root, and it runs backward and encircle the middle meningeal artery. You can see here is the middle meningeal artery, this one, and it encircle the middle meningeal artery and unite to form a single trunk. It unite to form a single trunk and passes between the neck of the here it passes between the neck of the mandible and spinomandibular ligament above the maxillary artery. We have studied the course of maxillary artery first division, so it passes between the neck of the mandible and the spinomandibular ligament, and here it behind the neck of the mandible, it turns upward and ascend to the temple behind the superficial temporal vessels. Okay, it ascend behind the neck of the mandible, it passes upward. Okay, and here comes the auricular part of this branch, and here comes the temporal part of this branch. Okay, so the auricular part of this branch, which supply to the skin of targus and the upper part of the pinnae, and external acoustic meatus, external aquatic meatus, and the tympanic membrane. And the temporal part which supply to the skin of temple, and this also supply to the parotid gland and to the temporomandibular joint. Okay, so it consists of two roots. It arises by two auriculotemporal nerve arises by two roots, and it encircles the middle meningeal artery to join to form a single trunk, and afterwards it behind the neck of the mandible. Here, after joining to forming a single trunk, it passes between the neck of the mandible and the sphenomandibular ligament, and it supply runs upward and to the temple region. Here, the auricular part which supply to the skin of targus, upper part of pinnae, external acoustic meatus, and tympanic membrane. Okay, and the temporal part which supply to the skin of the temple and to the parotid gland and also to the temporomandibular joint. The next branch of posterior division is the lingual nerve. It is one of the two terminal branch of the posterior division of the mandibular nerve, and it is sensory road. It is a sensory road. It is sensory to the anterior two-thirds of the tongue and also to the floor of the mouth. It is sensory to anterior two-thirds of the tongue and also to the floor of the mouth. The lingual nerve course is, first of all, here is the skull, is it? It begins 1 centimeter below the skull, and first it runs between a muscle called tensor veli palatini muscle and the lateral pterygoid muscle, and then it passes between medial pterygoid and lateral pterygoid muscle, and about 2 centimeter below the skull it joined here by the caudate tympani nerve, and we know that the ramus of mandible present here. Here comes the mandibular part, and the ramus of mandible will be present in this region. Okay, so it reaches, after passing between the medial pterygoid and lateral pterygoid muscle, it reaches the lower border of the lateral pterygoid muscle, and it runs downward and forward between the ramus of mandible and the medial pterygoid. We know that in the medial surface of the ramus of mandible there is the insertion of medial pterygoid muscle. So it passes between the ramus of mandible and the medial pterygoid muscle, and it comes in direct contact with the mandible. Okay, it comes in, then after that it comes in direct contact with the mandible medial to the third molar teeth. Okay, it medial to the third molar teeth between the origin of superior constrictor and mylohyoid muscles. Okay, soon it leave the gum and run over the hyoglossus muscle. Here we have studied the hyoglossus while studying the tongue. It leave the gum and run over the hyoglossus deep to the mylohyoid. Finally, it lies on the surface of the genioglossus deep to mylohyoid. Okay, and here it winds round the submandibular duct. Here it winds round the submandibular duct and divides into terminal branches, and it supplies to the submandibular gland, sublingual gland, and the anterior two-thirds of the tongue. The last branch of posterior division is the inferior alveolar nerve. Okay, it's vertically runs downward lateral to the medial pterygoid and sphenomandibular ligament. We know that the medial pterygoid muscle which is attaches to the lateral surface of the ramus of mandible. So it runs lateral to the medial pterygoid and sphenomandibular ligament. Then what happens? It enters into the mandibular foramen and runs through the mandibular canal along with the inferior alveolar nerve. So here in the mandibular foramen and in the canal, what are the structures present? Inferior alveolar artery and inferior alveolar nerve. So this inferior alveolar nerve, after entering through the mandibular foramen, it passes through the mandibular canal, and it passes out through the mental foramen as mental branch, isn't it? And here this branch give off a mylohyoid branch before entering to the mandibular foramen, the inferior alveolar nerve which give off a nerve to mylohyoid, and this nerve to mylohyoid is a motor, it consists of motor fibers, and it passes through the mylohyoid group and reaches and supply to the mylohyoid muscle and to the mylohyoid muscle and the anterior belly of digastric. And while running in the mandibular canal, the inferior alveolar nerve give branches that supply the lower teeth and the gum. And the mental nerve emerging at the mental foramen supply the skin of the chin and the skin and mucous membrane of the lower lip. And it give off incisive branch that supply to the labial aspect of gum of canine and incisor teeth. So these are the divisions of mandibular nerve and the area where it supplies. Okay, thank you.